Welcome back, everyone, to the afternoon session. Before we present on our recovery community organizations, I'd like to once again thank our sponsors. Today's nonprofit sponsors for the afternoon session include Indiana Recovery Network, Indiana Rural Opioid Consortium, Terra Treatment Center, and Regional Health Systems. Indiana Recovery Network is Indiana's recovery hub and aims to bridge gaps in services and engagement throughout the state to ensure that recovery support and services are accessible to all individuals. Thank you, Indiana Recovery Network, for being a nonprofit sponsor of the INARMS Symposium. The Indiana Rural Opioid Consortium is working towards building the necessary infrastructure to develop a regional model for opiate use disorder identification, treatment, and recovery services in rural areas and the communities it serves. Thank you to Indiana Rural Opioid Consortium for being a nonprofit sponsor. Terra Treatment Center's mission is to provide quality care to individuals and families affected by alcoholism and/or drug addiction by promoting lifelong continued recovery. Thank you, Terra Treatment Center, for your support and being a nonprofit sponsor. And last but not least, Regional Health Systems. Regional Health Systems is a federally qualified health center operating in 5 locations in 3 Northwest Indiana communities of Hammond, East Chicago, and Maryville. Regional Health is the first federally qualified health center to open inside of a community mental health center. Regional Health Systems, thank you for being a nonprofit sponsor of the INARMS Symposium. Now let us continue with the conference. In the afternoon session, we have Indiana Recovery Network's regional recovery hubs. Here you will hear from some of the finest leaders in recovery community organizations in sharing information not only on recovery community organizations, but specifically on their collaboration and the support that they've garnered for the state of Indiana and its recovery community. First off, I'd like to welcome Brandon George. We have multiple speakers and presenters during the session, and so please keep pace as we go through multiple recovery community organizations. Brandon George is the Vice President for Recovery Advocacy and Programs for Mental Health America Indiana and the Director of Indiana Addiction Issues Coalition, which advocates for recovery through public policy and education. As a person in long-term recovery, Brandon dedicates his time personally and professionally to fighting addiction and promoting recovery. Brandon has been used as a consultant for SAMHSA's Opioid Response Network, the Bureau of Justice Assistance, and is a contributor to Harvard Law Review's blog. He served as a trusted advisor to the National Judicial Opioid Task Force on the Leaders Council for Legal Services Corporation, and recently spoke at the White House for the Office of National Drug Control Policy regarding addiction, workforce issues, and recovery messaging. Join me in welcoming Brandon George to begin the presentation on building healthy recovery communities. Brandon?
Greetings, everybody. Thank you, Sunny, and thank you to Overdose Lifeline and the Division of Mental Health and Addiction for this conference. It's a really important time throughout the year to get the word out about programs that Indiana has going on, and we're humbled to be a part of that with this effort that we're going to talk about a little bit today. As mentioned, my name is Brandon George. One of the projects that I help oversee is the Indiana Recovery Network, and we're going to talk a little bit about that today with some of our amazing partners that you're going to hear from. We're truly blessed to get to do some work with some really amazing folks, and I'm excited to see their work being highlighted today. And so one of the things I want to talk about really to set the stage is that people talk a lot about treatment, and oftentimes they will conflate the word treatment and the word recovery. Next slide, please. And so to get everybody on the same page, we all know that substance use disorder is a chronic condition. We can call it a disease or a behavioral disorder, but the point is we know it's a chronic condition. And we normally treat chronic conditions for a long period of time. Cancer, diabetes, congestive heart failure, these chronic conditions people will be plugged into the healthcare system for years and years and years, probably the rest of their life. But with substance use disorder, our treatment models are really not reflective of this. And they oftentimes are set up much more in an acute care model, more similar to breaking a leg. And so it really begs the question, right? What is the goal? What's the goal of our response? What's the goal of what we need to do in our community? And the response that most people have immediately, next slide, is treatment. Treatment's the goal. And I'm really proud of what the state has done in this capacity. I certainly don't want to push that aside. You heard our drug czar earlier talking about a lot of the amazing things. Part of that is an expansion of treatment. I think that they've had a huge increase in beds and availability. However, I think that it's really important to note the same way that getting chemotherapy to a cancer patient is vital, it's not the goal. The goal is remission. And so I would also say that our goal here for substance use disorder is not just treatment. The goal we have is indeed recovery. Next slide. And so for those of you who don't know, this month is Recovery Month. And it's been a little hard to get excited because of all the overdoses that are occurring, but it's important to bring a message of hope and to make sure people know recovery is possible. And so what I want to do is talk a little bit about the 4 dimensions of recovery and what sets apart recovery from treatment. And so the 4 dimensions of recovery as defined by SAMHSA are health, home, community, and purpose. And I want to stay here for a minute to dig a little bit into these. Health, the very first part of this, that's where treatment fits in. Treatment is part of one of these 1-4 categories. And so we've got traditional treatment, you've got detox, residential, therapy, syringe service programs, medications for opioid use disorder, medications for alcohol use disorder. All of these fit inside that health category. But as most people know, certainly the people you're going to hear from today, that is just one piece. Having structured, healthy living environments like recovery residences and stable housing where people can live and not worry about whether they have a roof over their head. I'm not sure about how many people on here have had to experience this, but it's hard to focus on things like therapy and getting better when you don't know where you're going to sleep at night. And so this is a vital component. Community we hear a lot about, right? Your 12-step programs, your AAs, your NAs, Celebrate Recovery, Smart Recovery. If it's family, it could be the craft model that we heard about earlier for families that are healing. Faith-based groups, Celebrate Recovery. These are all the healthy connections and community that people are going to get connected to. And lastly, purpose. Purpose is what we get up and do every day. And so if that's school, in relation to this, it could be Hope Recovery High School, or it could be some of the collegiate recovery programs that IU has or IUPUI has, things that are focused specifically for those who are in recovery from substance use disorder. And then workforce issues. And the Indiana Chamber of Commerce has their Indiana Workforce Recovery Initiative to make sure we're providing support for people who are in recovery. And so when you look at this, it's much broader than just the treatment piece. And so our response to this needs to be much broader. And again, we need to make sure we have the treatment portion of this, but our solution needs to be much broader, and what that involves and what we're going to talk about today is the beginning of this. And we're going to talk a little bit about recovery ecosystems. And so, next slide. One of the things that we realized several years ago is that Indiana did not have a recovery infrastructure. We've got an infrastructure for treatment. We've got an infrastructure for community mental health centers around the state. We've got an infrastructure for the hospital association. We've got all these groups that are organized, that have coverage throughout our state, and a way to plug into it. And we realized that we do not have that in Indiana. So about 3 years ago, we created the Indiana Recovery Network. Heather, the manager of that program, is going to talk after me about details of it and what all makes it up and the different groups involved and how the Recovery Hubs project fit underneath that. But for these purposes, I want to just talk about the general need for recovery ecosystems and how the Indiana Recovery Network fills that void. And so when we talk about recovery ecosystems, we're really looking at the different types of recovery organizations that make up this infrastructure. And so one of them is recovery community organizations. Heather's going to talk in detail about these. You're going to hear from leaders from several recovery community organizations. Another key part of recovery infrastructure are the people working in the field, peer support specifically, both certified recovery specialists and certified addiction peer recovery coaches. So people with lived experience in substance use disorder who have training and certification and can help people navigate what is otherwise a really difficult and almost broken system. Our addictions treatment system is completely siloed off from the general healthcare system. And so normally you go to a primary care physician or you go to a med check to get what you need or at least get plugged into the system. And our addictions treatment is completely siloed off. And if you haven't been in it before and you're a family member looking for help for a loved one, it can be daunting. And so having a peer support there to help a person navigate through this system is absolutely vital. Shout out to Recovery Cafe model. Recovery Cafe is a tremendous model that was brought here by a group called We Bloom. They've got recovery cafes in Lafayette and Indianapolis, but that's one of them. Recovery engagement centers. You're going to places where actually people can go. A lot of times people get home from treatment or they get home from jail. They wake up the next day, and my big question is, where do they go? Where do they physically go? Because if they don't need treatment, they don't need to go into that treatment system. And the answer to that is they need to go to recovery organizations. Recovery organizations like the ones that are on the call today, many of them have recovery engagement centers. By recovery engagement center, I mean places where people can physically go, locations that they can go into, actually see recovery coaches, and get connected to all those 4 domains of recovery. And so I'm excited to listen to what Heather has to say, to talk about some definitions of RCOs and to talk about how the Recovery Hubs project specifically helps fill this need in Indiana. Thank you.
Thank you so much, Brandon. We welcome Heather Rodriguez. Heather Rodriguez is the Manager of Recovery Community Development with Indiana Addiction Issues Coalition and is the manager of the Indiana Recovery Network. Heather oversees the day-to-day operations for the Indiana Recovery Network, which is an online recovery community with over 70 statewide recovery organization members. Heather oversees a statewide regional recovery hub program consisting of 16 recovery organizations providing free community-based certified peer recovery support services for individuals and families in need. Heather assists individuals or organizations throughout Indiana in building capacity for recovery community organizations or recovery community centers. Heather has a bachelor's degree in social work from Indiana Wesleyan University and is a certified addictions peer recovery coach. She is a person in long-term recovery and believes that recovery supports are an integral part of an individual's journey to overcome challenges associated with addictions and mental health concerns. Please welcome Heather in joining us on sharing what is a recovery community organization.
Thank you, Sunny. So as Sunny mentioned, I'm going to discuss recovery community organizations and touch a little bit on the IRN and our regional recovery hub program. So recovery community organizations are independent, grassroots, nonprofit organizations. They can be under the umbrella of a parent organization, but they should remain autonomous and provide services specifically to the recovery community. RCOs were and are created in response to unmet needs in communities for individuals and families seeking or in recovery. So these would be community members who have identified a gap in service in their community or just a general lack of recovery support services in their community, and have been motivated to bring about positive changes for the recovery community. And I like to refer to these individuals as recovery warriors. They're out there doing the work and actually taking action steps to make positive changes. And there are 3 core principles to an RCO. So just real briefly, one of them is a recovery vision. And what that means is a reality of sustainable recovery services that are quality services and the inclusion of the recovery community. And then the next one is an authenticity of voice. And that takes into consideration the needs of the recovery community and finding ways to bring about those services that the recovery community has identified. And then lastly, accountability to the recovery community. So again, just being accountable and responsive to the recovery community, providing services that they are seeking and not just telling them what they need. And then there are 3 core strategies to an RCO, which are public education and awareness. It could be policy advocacy. And then lastly, as Brandon mentioned, peer-based and other recovery support services. So peers providing those services to individuals in the recovery community. Next slide, please. So recovery community organizations are led and governed by the local recovery community. And what that means is individuals with a lived experience of recovery, and that could be friends or family members who are leading the charge on creating these organizations. They provide a safe space for individuals to support one another throughout their recovery journey. And then they demonstrate to the community that individuals in recovery can thrive and give back to the community. So again, just letting the community know that we do recover and we can contribute to our communities. They also provide sustainability for individuals in recovery, and they can be complementary to treatment models, but they do not provide clinical services. Next slide, please. And recovery community organizations are diverse, so they can be statewide with a focus on advocacy and education, or they can be community-based. They can also focus on specific populations within the community or be open to all members of the community. They can be faith-based or secular in nature. RCOs provide direct services through peer supports, and then peer supports provide linkages to resources within the community. They can help individuals develop life skills, different skills development type classes can be offered at RCOs or recovery engagement centers. They provide a space for safe, sober social activities such as yoga, art classes, community cleanup days, and volunteer days. And that again just reflects and shows the community that individuals in recovery can be a part of the community and give back to the community. And also just to mention, individuals in recovery still want to have fun and they still want to connect with other individuals in recovery. So RCOs provide that opportunity and space for connection. So how you can connect with RCOs throughout Indiana, as mentioned, the Indiana Recovery Network was created to provide one location for individuals, families, and other organizations to connect with recovery organizations. Our website is the indianarecoverynetwork.org. The IRN, the goal is to remove barriers to accessing these recovery supports and services throughout the state. Individuals can come visit the website and conduct searches by city or zip code. And this kind of minimizes that search just by going through general search engines. You can just connect with whatever's near you through those searches. And then you can connect to over 70 registered recovery organizations that we have as members. We also have an events page on our website where you can find fun sober social activities that are going on around the state, trainings, conferences, anything like that relates to recovery. And then we also have a news link that is related to addictions and mental health and specifically recovery. And that's information throughout the state or even national. Next slide, please. And then also on the website, individuals can connect to our regional recovery hubs that were previously mentioned. And just to give a little back story on that, the regional recovery hubs were created in response to COVID-19 restrictions. And these were in partnership or are in partnership with FSSA, DMHA, Mental Health America, Indiana, and with support from the Governor's Office Next Level Recovery Program. These hubs are comprised of 16 recovery organizations that are strategically placed throughout the state, and they provide recovery services to all 92 counties in Indiana. These hubs are delivering community-based peer supports to individuals with mental health and or substance use concerns. As mentioned, these services are free through the grant that we were provided, and they are not tied to a specific provider or insurance agency. Individuals can also connect to peer supports through Indiana 211. We have peer supports on there from our hubs available 7 days a week. We also have Peers app available to both Android and Apple users. And also on the IRN homepage, we have a connect to a peer link where individuals can request to have a peer follow-up with them within 24 hours. So those are all available again on the IndianaRecoveryNetwork.org. Thank you. And then Sunny, I think we have Natasha and Mercy next.
Sorry, it looks like Sunny lost her power. So we're gonna pass controls over and to, I believe it was Natasha's gonna speak.
Okay, well, I'll go ahead and do the introduction. So next we have one of our member organizations who happens to be one of our regional recovery hubs as well, Minority Recovery Collective, Inc., also known as Mercy. And so we have Aisha Wesley presenting as well as Natasha Cheatham. So go ahead.
Give us a moment here. Is there a way for us to change the slides?
Can you hear me now at least? Okay, I think so.
Yeah.
Yes.
I can hear you.
Okay, perfect.
Is there a way for us to move the slide along?
I don't think so.
Sorry, checking. I think Sunny was running it and she just lost power. So
Yeah.
looking for the slides.
Do you want to take a moment for her?
Yep. My camera's being weird on my end.
I was saying, Natasha, do you have your webcam covered?
No, I don't. I don't know why it's not showing me.
Mm-hmm.
I don't know. Hold on. Let me try to figure some things out here. Let me go off. It may be back on.
Sorry, we're looking for the slides.
Oh yeah, no, you're fine. Take your time. Ta-da!
We have Natasha.
Right. Like I don't know what my camera was going through there.
Well, if you would go ahead and just introduce yourselves and talk a little bit about your organization, and I will try to catch up with the slides. Apologize.
Not a problem. So my name is Natasha Cheatham. I am the founder and director of Minority Recovery Collective, Inc. We go by Mercy, and today I'm joined by our program director, Aisha Wesley.
Hi, my name is Aisha. Like she said, my name is Aisha Wesley. I am the program director of Mercy. I'm also an Indianapolis native, a proud member of Alpha Phi Omega Service Fraternity and Sigma Gamma Rho Sorority, Inc.
All right. So we are not going to read our bios. We're just going to get right on into it. So through our mission of normalizing recovery through stress reduction for communities of color, we hope to honestly make recovery synonymous with healing for minority populations. From our work over the last 2 years in existence, we have noticed that not only do communities of color require special attention, if you will, but they also need safe space. So that is our overall goal. I won't read off the slide here, as you can, you can't see. Sorry. Our vision. Our vision is to be an innovative leader in recovery who promotes self-actualization, healthy relationships, and positive social skills. Our areas of focus are healthy social engagement, natural nutrition and active living, and then crisis intervention, rest, and then stress reduction. So I'm on the second slide. Thank you. That is much better because I was not prepared to read all of that. All right, so here's the slide here. Our core values, I'll wrap this up, are integrity, resilience, and transformation. All of these things came from our initial work in our first year, year and a half, if you will. Again, talking directly with the community and working with them, we allowed them, if you will, to shape our organization. So up next, we will talk about our team and a little bit about our culture and our programs, and I will let Aisha take it from here.
Thank you, Tasha. So the lovely people before you are our teammates. Each one has their own particular area or lane that they manage. However, each one of us is either trained to be a recovery coach or are slated to become one before the end of the year is up. So as much as work we do inside of Mercy, we also duplicate that outside. Next slide, please. And so from our community forums that was earlier this year, we created the unique recovery pathway program and peer support group. Currently, we meet on Wednesdays. We'll be meeting tomorrow, but we meet on Wednesdays. Coming in November, we will be meeting Saturdays in addition to Wednesdays, as well as taking scheduled one-on-one appointments. Also, if we go down a little further there, we see and we like to put out there that our community outreach program has expanded this year, and it has expanded to 2 specific areas. The first is our lot ministry, which with that, we address our community's basic needs, and then also adding into that our SEEDS program, our SEEDS Center, which we are actually currently in a fundraising for to create a recovery engagement center. All of these things, again, were brought to us by our community through our recovery, State of Our Recovery forum series earlier this year. Next slide, please. And I'm going to pass this back to Tasha.
Tasha, are you muted?
Hi. Thank you. So we know that in our first 2 years of our grassroots efforts and hearing and working with our community directly, we know that our long-term goal is a sustainable living recovery community where not only minorities, but all are welcome. We just cater to minorities, let's be clear, but where people can thrive, and live their absolute best life in an environment that is honestly designed with them in mind. Where not only recovery is obtained, but it is maintained for the long term. While we understand that this is a Herculean task, we also understand that even Hercules took things one step at a time. And so our very first step in this process will be, as Aisha stated previously, our fundraising efforts to bring about what we will call the Seed Center on the east side of Indianapolis, and then eventually, like we said, expanding the lot ministry into to help our homeless population as well. Next slide. Our last slide is our contact info and our way of saying thank you to our partners and clients and even sponsors our very first 2 years in operation, So we have BU Wellness Network here, the Division of Mental Health and Addiction. We have the MLK Center, the Indiana Recovery Network, and RCR Technology. These organizations were absolutely imperative in our first 2 years in expansion and growing, and we're so excited and thankful for the opportunities to come.
Natasha, Aisha, thank you both so much, and your grace under pressure with the most recent technical difficulties. You ladies are doing incredible work for our Black, Indigenous, people of color with your Mercy organization. We look to hear so much more from you both. Thank you for being presenters today.
Thank you for having us.
We'd love to welcome Phil Stuckey next. Phil Stuckey is Executive Director for Thrive, Recovery Community Organization located in Scott County, Indiana. Phil oversees the day-to-day operations for Thrive with 18 employed recovery coaches and a satellite hub for the Southeast region, covering 21 counties throughout the state. Phil is the coach manager, case manager, recovery coach supervisor, and clinical liaison at Columbus Regional Health's Treatment and Support Center located in Columbus, Indiana. He is a member of the Adult Recovery Court team with Bartholomew County, as well as a part of the InStep Consumer Advisory Group. He has his certified addictions CADAC, CSPR, PR, CAPRC 2 credentials through ICADA. Phil, I'm sure you'll be sharing much more about all of your certifications with us, and thank you for being with us today.
Well, thank you very much, Sunny, and thank you everyone for having me. Luckily, I don't have any slides, so if there is any more issues with power outages, I think we're all going to be okay on this one. As Sunny was stated, my name is Phil Stuckey. I'm the Executive Director of Thrive, which is an RCO located in Scott County, Indiana. And with that being said, I would need to give somewhat of back part on what Scott County, Indiana, because most people that hear of Scott County, Indiana still think of the 2015 epidemic with the HIV outbreak that we had. It made national and national news as well, of course, throughout. We had in that first year of 2015 that kind of the outbreak happened, we had 198 new cases that came through. And since then, the CDC, when they came in that first year, they kind of put us to be at 25 new cases per year going forward. And I can tell you that right now, the total of cases, and this is the totality since 2015, is 230. So that means we've drastically declined the new cases to 2017 was 12, and then 2018 and 2019 both with 10 new cases. And a large part of that was the national and of course throughout the state, that all the people that came in to our community to help us out with not only getting our syringe exchange program going within April of that year, stigma education and trauma informed care and education that was brought through that county. We went from having 3 peer recovery meetings a week through multiple pathways to now we have 17 meetings that happen for peer recovery, for peer support meetings. In 2018, we were formed. Thrive was a formed RCO, and with the help of DMHA and FSSA and of course the IRN, we're servicing the 21 counties as the anchor hub within the Southeast region. We employ 18 certified recovery coaches and of course the satellite hub. One thing that I will speak on and being about in a rural community is we identified very quickly the barrier of transportation and induction with MAT services. With the help of this program throughout the state, as of October 1st, we are launching our mobile recovery coaches with tablets for MAT induction, as well as clinical telehealth assistance for SUD and mental health sessions. And we'll have that induction to MAT services within 24 hours. We are also partnered with some providers to run medical mobile units for HIV and Hep C testing. With also the mobile unit will do medical clearance services for participants that are looking to be medically cleared for inpatient residential detox services. We've partnered with inpatient facilities in our region to introduce participants to peer recovery coaches within the community. They are either returning or going to be going after residential care. So that means they're already, while they're in that safe place of that residential facility, will have at least one strong person in their community they're returning to or going to for the first time that is in recovery and can help guide them through the resources that they need when they get there. We have also partnered with recovery residences in our region, such as the Oxford House and other recovery residences that we have, to actually have a recovery coach assist and help broker resources within each one of their communities. So that means that at least at the minimum of once a week, a recovery coach will go out to these recovery residences and see exactly if there's any needs that are any barriers that they need help with, such as, you know, if it's where do I go for my birth certificate, social security card, resume building, employment, and so that happens at the minimum of once a week. Another thing, Thrive has a recovery engagement center, as Brandon was speaking about at the beginning of this presentation, Monday through Friday, staffed with certified coaches that help from partners in our community perform HIV, Hep C testing, pregnancy testing, as well as insurance navigation. We also have monthly events, including family and friends, and of course, allies sponsored through our community. We have a weekly game night on Friday nights for the families, children, and anyone that is even interested in what we do in Scott County to come down on Friday nights, have a meal. We're sponsored. We have relationships with our community, and we're sponsored to have at least a meal donated per each game night. And then also we offer a safe place for people to feel non-judged, and just as Brandon was kind of speaking, just a place where they can kind of just be okay. You know, they not knowing what services they need from inpatient to outpatient, just a recovery coach to find help with a peer support meeting, but just a place to come and talk to somebody. But I believe one of the biggest things that we offer there is hope. There's no more slides. I can't say next slide, please. But I appreciate your all's attention. Hopefully my presentation was memorable enough that we didn't need the slides, but if it wasn't, I'll try better.
Thanks so much, Phil. Well, we have a wonderful comment and shout out to you from Jeannie Reed saying, shout out to Phil Stuckey for all you are doing down in Scott County. So thank you so much for all your work and efforts.
Thank you.
Thanks, Phil. I'd like to welcome Rhiannon Edwards. Rhiannon Edwards has served as Executive Director of Public Advocates in Community Reentry, PACE, since 2008. Today, PACE is the principal organization in Indiana in the field of community-based reentry. PACE's mission is to provide a variety of services to help those with felony convictions and their families to lead productive and responsible lives in their communities. Rhiannon began her career at PACE as the employment developer and created the agency's first official employment program by targeting employers who were willing to hire those with felony convictions. She has also served as the Director of Transitional Services and Employment before being promoted to Executive Director. Rhiannon has a bachelor's and master's degrees in criminal justice. She is a national accredited and certified facilitator of both moral recognition therapy and offender workforce development specialist trainings. In 2009, Rhiannon was appointed Director of Reentry under Indianapolis Mayor Greg Ballard and was a founding member of the Marion County Reentry Coalition. She has been appointed to numerous coalitions and committees, including Indianapolis City County Council's Reentry Policy Study Commission and United Way's Public Policy Committee. Rhiannon, welcome.
Thank you, Sunny. And thank you to Brandon and Heather for allowing all of us to come into this presentation and talk about the great work we're doing in the hubs, and greatly appreciate this opportunity. So I will start off with, I'm Thrive. So I guess I'm with Phil at Thrive. I'm just kidding. So I'm with PACE. PACE stands for Public Advocates and Community Reentry. We've been around, oh, next slide. You can go ahead and skip to the next slide. So we've been around since 1960. Over 60 years, we've provided a lot of different services from pre-release to post-release. But the main constant throughout those 60 years is serving people with criminal histories. So that is our main goal in whatever programs we do. I'm not going to go over all of our programs, but we've got listed we've got a comprehensive range of programs, like I said, from pre-release to post-release, employment services, etc. Within the recovery services arena, as Brandon and Heather both mentioned, we have a recovery resource center, or an engagement center, as they said. That recovery resource center is led and staffed by all persons in recovery. Many of those persons also have lived experience with the criminal justice system. We do peer recovery coaching, substance use counseling, relapse prevention groups, and as Sunny mentioned, moral recognition therapy, which is a cognitive behavioral approach to looking at criminogenic thinking and reducing recidivism. And we also have traumatic brain injury groups as well for persons impacted by that. Next slide. So I wanted to give you guys a little bit of a look at the population that we serve. In 2019, we served 3,679 individuals. The majority of those individuals are Black males. And historically, that's what we see every year, is we're predominantly seeing Black males. 97% of the individuals we serve are at or below federal poverty level. We were able to place 416 individuals into employment, and then we've listed the top zip codes of where people reside that we're providing services to. Our recidivism rate is 4.3%, which is very, very impressive when you look at the county and state averages, being the state at 30% and the county around 50. Next slide. So I want to talk a little bit about what we see in terms of barriers with the reentry population as it is applies to addiction and recovery. First barrier that we see is access to treatment. And so Brandon mentioned earlier in his presentation about expansion of treatment and recovery services. We also see a stigma associated with that, where our population, whether it's because they looked at it as a time cut when they were incarcerated, whether it's there was a first person in their family to recover, there's definitely a stigma of getting people engaged in those services. And so we use our peer coaches to help people navigate that, tell their version of what recovery looked like for them. Another barrier that we see is unaddressed trauma. Our population is predominantly looked at for their criminal history. And so a lot of times people don't realize that they were victims themselves. They went through things themselves. And so we are constantly trying to bring awareness to that fact that the majority of people don't just wake up one day and decide to commit crime. There's normally a domino effect that happens. Another barrier is lack of communication between community agencies and criminal justice agencies. And so I think that is one key component of the recovery hubs, is that, we're all communicating more with criminal justice agencies, which we found in our history, that's number one. When you're working with the reentry population, you've got to have that relationship in order to help them navigate both their recovery, their reentry, and whatever commitments they have to criminal justice agencies. And the last thing that I'll talk about, and I'm sure this is something that affects, this is not just a Marion County problem, this is a statewide problem, and that's housing options. And that really falls in 3 categories. For reentry, we're often looking for transitional housing. Individuals may not be ready to go live on their own, and so there's a lack of that here in Marion County. Permanent supportive housing, and then affordable long-term housing options. And I just want to stress that that is because of the felony. The felony is definitely can be a scarlet letter for people that are trying to reenter. So I don't want to end on a negative note. So what works? So what we found what works in working with the reentry population is doing an assessment and treatment planning. And so a lot of times people think, I just need a job. That's all I need is a job. And you definitely need a job to be able to take care of yourself and your family. But we've also got to figure out what led to the incarceration so that we can kind of work with that, help address that, and then people can move on. Care coordination. So by care coordination, I mean working with multiple agencies. We don't just refer our clients to other agencies. If they need to go to an inpatient treatment facility, then we're going to coordinate with that facility and make sure that there's a warm handoff between us and that agency, and then continue working with our client while they're there. As I mentioned before, strong relationships with criminal justice partners. So your local probation, parole, jail, community corrections, having those relationships so that we can help people navigate. I don't think it's, I don't think it would be odd or anyone would be shocked to know that it's, it can be difficult to navigate the criminal justice system. And so having these relationships so that we can help our clients navigate through is very important. And then finally, hiring people with lived experience. So we have people with lived experience both in recovery and in incarceration on our board and on our staff. That is very important to our agency. It's been that way since we were, created 60 years ago. Without those voices, we could not be able to provide the services that we do. And so that's very important to us. Next slide. Okay, and that is all for me. Thank you.
Thank you so much, Rhiannon. We appreciate you sharing so much on PACE. This is a great program. We'd like to welcome Justin Beatty. Justin Beatty is Director of the Mental Health America Institute Training Institute, Deputy Director of ICADA, and Director of IPRIS. He identifies as a person in long-term recovery from mental health, substance misuse, and the justice system. He holds multiple peer recovery and clinical related credentials. Justin works alongside the behavioral health community to strengthen the workforce and supports provided through education, support, and advocacy for marginalized populations and those seeking or in recovery. His dedication to the mentality of any positive change and any pathway of recovery allows all to feel included in the recovery process. Justin continues to work towards advancing the efforts of those who wish to ensure there is equity in the recovery process for everyone. Welcome, Justin. Oh, Justin, could you unmute?
I just noticed that. So good. I was hoping I would make some folly as well, and I didn't. So you don't ever realize how long your bio is, so you have to sit through it and stare at a computer screen where you see absolutely nothing else. So we didn't have the ability to provide everybody that's involved in this recovery hub process in here, but I want to point out that we got a lot of amazing things going on throughout the state. And for a lot of people, they're thinking, man, this peer recovery supports came out of nowhere. Man, there's a lot of backing for this and stuff. But actually, that's not the case. This has been a long process to get peer recovery support and get the focus on recovery supports where it is today. As Brandon had mentioned, and a lot of other people had mentioned, historically, we've had things from an acute care model where we've looked just to stabilize someone in their diagnosis. At best, gave them a piece of paper or connected them to some stranger on the phone as they were leaving and said, see ya, hope we don't see you again, and then faulted them when they came back as if they did something wrong. Where realistically, it was us as providers and us with a narrow focus of recovery that did something wrong. And we're not fully supporting a person in a holistic aspect. So as we've built this infrastructure for peer recovery supports in the state of Indiana, the whole focus of peer supports, as has been talked about before, and several of you viewing know, is focusing on what do you need and how do we support it. And so it's looking at that of this true idea of positive change of being the recovery process. What do you need supported from us? What do you need supported from the community? And so we had to get our community to an understanding of that, but we also had to get the professionals that were providing peer recovery support to a process and get to a point where those working in the behavioral health field trusted them, understood their competencies, understood their role, but also we had a workforce that was, one, willing to provide, a positive lifestyle change mentality to people rather than only an abstinence-based mentality. And then also looking at this full equity around supports throughout our state. So next slide, please. So before I talk about these ideas of what kind of started happening in 2018, is peer support's been around since the beginning of time. If you look back through any historical books or anything, you'll see that people like to talk to people that have similar lived experiences to them. So this is not a foreign concept to just supports in general. However, when we started looking at people that were in a state of wellness from mental health issues, and some form of recovery from substance use issues, we kind of got this discriminatory idea about them that I don't really know if they can do this, or they should do it over there, but not here. So peer recovery support training and credentialing has been around for quite some time, and in Indiana for several years. And as part of it, unfortunately, though, is we as training agencies, we as credentialing agencies, trained credentialed people and then kind of sent them into the wild. We didn't provide the kind of professional backing that an up and coming profession really needs. And so in 2018, from a grant funded by DMHA, Indiana Association of Peer Recovery Support Services, which was then a project under Indiana Addictions Issues Coalition, secured a grant to start creating peer infrastructure. And what we did is we created an advisory board of people that had been doing peer services around the state, people that had been involved in policy development, systems creation, all those kind of things. And we sat down and we looked at stuff. And we said, what needs to be done? Because in behavioral health, a lot of people don't like to look at the business aspects of it. But what we did is really looked at this from how do we truly support this profession? How do we keep it moving forward and get it to the point where people recognize it's evidence-based, recognize that these aren't just paid sponsors or anything like that. And so in 2018 in the fall, we started looking at creating this advisory board, as I said. And some of the efforts from this advisory board is we created documents to clarify what the peer recovery coach role was, and equally important, what were the supervision competencies around people supervising peers? Because a lot of times peers were the buzzword. I always joke that it was like Veruca Salt from Charlie and the Chocolate Factory, where it's like, I don't know what this is, but I want it and I want it now. And unfortunately, some places weren't doing the greatest job integrating their peers in. They were thrusting people that weren't really prepared to supervise a role they knew nothing about. And that's no fault of the supervisors who were doing it. That's the role they were thrust in. So we created these documents that can be found at IPRS's website, IAPRSS.org, around what are the standards for professional peer recovery coach practice. What is the scope of practice of peer recovery coaches in the state of Indiana? Because SAMHSA has some amazing documents. We used those as our foundation and found a couple extra little things we maybe needed to add that were specific to Indiana. Kind of same thing with the supervision document we created around the competencies. We used SAMHSA's, we used other people's as our base, and kind of looked at what do we specifically need here in Indiana to go above and beyond what these national standards are. We also started to look at what the trends are for the profession. Who's hiring peers? What are they paying them? What is lived experience defined here versus there? What credentials are being used? Are people even being credentialed? Are they being hired because they're credentialed or not? You know, all these different kinds of things. And kind of one of the other things we did is we did an analysis of a couple different educational curriculums and credentials for peers and provided recommendations to DMHA for our suggestions of what should be the reimbursable credentials for Indiana Medicaid. So this was continued throughout 2019. And as part of that, we provided other recommendations around there being clear language on peers, clear language on lived experience, you know, these kind of things, because if you've ever worked around peer services or been involved with them, there's a million different terms. You know, if you were on the webinar yesterday morning where Paul talked about CHWs, it's the same with peer recovery supports. Is it a peer specialist? Is it a recovery coach? Is it a peer recovery coach? Is it this? Do I call it blue? Do I call it purple? Am I even allowed to use that word? You know, all these kind of things. And so we knew that for this to be looked at as a continued recognized profession and for peers to finally be looked at as professionals and not paraprofessionals, because they're not half anything, they're full professionals. What did we need to do to advocate for this role? And so that's where we provided those documents, we provided those suggestions, and as part of it, we recognized that there was a need for peers to be provided professional development. So we started providing professional development to any currently aspiring peer or any peer in the field. And that was all kinds of stuff. That was resume creation or any of these kind of things. And then the other part we did is provided organizational consultative assistance for people that wanted peers, for people that had peers and wanted to strengthen their programs. Next slide, please. And so where we've worked at since the summer of 2019 to today, since we kind of started creating this, as you can see on the slides, we've done a lot of stuff. One of the things we've done that we found so important that necessarily isn't done through a lot of other professions is keeping the professionals around the state who are providing peer recovery support services connected. So one of the things we've done is we created a statewide monthly support group for peers to get together to network and talk to each other. And as part of this, we created other meetings for more localities. And so it was for the local peers to get together and talk. We've also created a monthly peer recovery support supervisor gathering. This is for the people that are currently supervising peers to get together and talk about what's going on. We've partnered with national thought leaders and other states to assist with improving peer programming. And the reason I give you this history is, one, peers haven't came out of left field, but because of this work and all the amazing peers we have in this state and all the amazing organizations, not just the 16 that are part of this regional recovery hub, that's the reason projects like this are possible. This is the reason we're be able to have community-based recovery support, where you don't have to go to a provider and receive other services. You don't necessarily have to get clinical engagement. You don't have to do this and that. It's when you recognize you need someone to talk to and you need some resources, there's a peer for that. They're in your local community that can do these kind of things. And that's what they're really there for. So that's the whole aspect of this, is just really that this has been a movement that's been happening for some time. It's continuing to happen, and it's because of everybody in the state recognizing the power of that lived experience and being able to talk to someone that's going to support you with where you're at, not where they think you should go, that allows this to really happen. So not only do I want to thank the 16 organizations that are involved as part of the Regional Recovery Hub process and all our gracious funders, I also want to thank the community for maybe not even being behind this, but at least being open-minded enough to realize that people can recover, they do recover, it's an expectation, and that we have something to give back to the community. So thank you everybody for believing in this project and taking the time to come see all of us and sit through this.
Justin, thank you so much for your passion and dedication and the great information shared with us today. I'd like to welcome back all of the speakers to share their webcam and also to unmute to have an opportunity to answer questions from our audience. the first question is, how did you all come together to collaborate in this session? And why is it important for the recovery community to understand that collaboration takes place? And I'll direct that maybe first to Brandon, and then we can have the entire panel chime in.
Absolutely. So this is, as you've all heard, just amazing groups on here doing just absolutely tremendous work, and we're proud just to be involved. And one of the reasons that it came together specifically for this presentation is we really wanted to highlight this idea that recovery is local. Recovery needs to take the shape of the community that it's in. And so as much as the state, Division of Mental Health and Addiction, the Indiana Recovery Network want to, provide support, what we really realize is that it needs to take the shape of the local neighborhood, the local community. And so we wanted to highlight that the best way that we could. And so by having Mercy on, that really focuses on minority populations, having Thrive on, that's in a rural setting, much different, right? It's a really different geographic location, different people being served. PACE, they're dealing, usually almost everybody they serve has incarceration issues. So they've got multiple kind of strikes, against them, not just the SUD piece. And so we just thought it was really important to highlight how different these are. Look, the recovery organizations need to be as different as the people they're serving, right? Like we need to have as wide variety of recovery organizations as we do the people we serve. And I think this group is pretty representative of that. So.
Wonderful, thank you, Brandon. Other panelists, additional insights?
I think I'd like to just add that by having the diversity and showing the diversity of recovery community organizations that are available in our state, it also reduces the stigma that's tied to addictions and mental health concerns with specific populations, whether it's minority, rural, reentry, what have you. There's all stigma that we all face in those populations. I think it's good to just highlight that there is help available, that there are organizations that exist and focus on these populations, and that you can connect to these organizations, obviously, through the IRN and the recovery hubs.
Great points, Heather. Others to chime in?
What they said.
Great ditto. Excellent. We have a lengthy question from Catherine Tavishan at Anthem. I'm going to give the first part of the commentary and then the question. There has been a lot of recent research by Dr. Lance Trexler at RHI and others about the large percentage of those with criminal justice involvement who have a history of traumatic brain injury. Their research also indicates that up to 30% of those seeking substance use disorder treatment, whether or not with criminal justice background, have a history of moderate to severe traumatic brain injury. Their research indicates that individuals with co-occurring traumatic brain injury and substance use disorder have higher fatal overdose rates and lower success rates with recovery. How can we better integrate care for these individuals to reduce mortality and increase recovery success?
So I'll answer, or I'll try to answer that, Sunny. Dr. Trexler actually was the doctor that helped us create our traumatic brain injury program at PACE. And through that program, he identified a screening tool that we could utilize. So you can screen individuals to find out if they have a moderate to severe brain injury. And I definitely think that is a resource that should be expanded. What we did find is a lot of the individuals that we serve didn't even realize they had a brain injury. It was an accident in their childhood, and they just were never told that it was a brain injury. And so there are a lot of people out there that have a brain injury that don't know they have a brain injury and don't realize that the incarceration, the addiction, all of that is tied together. So I would definitely suggest, a vast utilization of that assessment to determine if someone has a brain injury.
Excellent commentary. Are we using screening assessments or tools today to ensure that that traumatic brain injury is being identified?
We are at PACE. We use one that RHI utilizes. So our staff was trained by RHI to utilize it. I don't know if others use it, but RHI has a screening tool that they utilize when people come through their services, not through their hospital, but through general services. And that's what we use at PACE.
Rhiannon, could you share that as a follow-up handout for our audience members? We'll post that along with the session recordings. Excellent.
Sure, definitely.
Other panelists to chime in?
The one thing I would mention, and certainly on a side note, is one of the benefits and the reasons for creating the Indiana Recovery Network was so that like-minded, like service providing folks could learn from one another. And so I'm guessing there's not a lot of RCOs out there screening for TBI. And so having, again, one of the people involved in this who does do that did have something created by a well-known doctor in this area, provides others the ability to not have to go through the same grueling process as PACE did, or the same process. We get to save some time. We get to not fumble around trying to figure stuff out, and just another benefit of being connected to one another, I think.
Fantastic. Other insights before we move on to the next question? All the panelists have shared such insights on Indiana Recovery Network being a collaborative, standards-based, and also surveillance, really, of what the recovery community needs. When you look at all the different organizations that are collaborating today, what other services and what other organizations are still yet need to become partners?
I'll take this. You could never have too many partners. I mean, when you're talking about recovery support, Brandon talked about those 4 dimensions. Like, I don't think you can ever have too many supports around safe, secure housing for someone. I don't think you can ever have too many, and I can go through the laundry list. But one of the biggest things with recovery support is looking at that equity for each person. Each person's needs are different. Each individual, we have to look at recovery from a real individual recovery plan, not a cookie cutter with someone's name different at the top. Let's start really looking at it as each person's individual needs, and then we'll realize that we need all the community partners we have. So I don't think you can ever have too many partnerships. I don't think you can ever have too many resources, because when I think I have enough, next person I go to support, they've been through all the connections I have, and they're not interested in them. They didn't work or anything. So, I mean, in my opinion, the more the merrier when it comes to partnership and collaboration.
Sound
I
advice,
would like to
Justin.
sorry. I was going to say, adding on to that, with adding more partnerships here, I think we also have to take into account that each one of the organizations that are represented here today are not silos. Each one of us are connected to multiple different networks, such as I mentioned earlier. I'm part of a sorority. So in that, I have a whole group of women who are from different walks of life, who are in different fields that I can reach out to, and I can use them as a resource in my work. So in that, even though we might not have every single type of person that we might need to fully support our family and our community partners, we each are able to pull from that network. And the fact that we all are here, we are able to also have those conversations to say, hey, Rihanna, I need this. Do you know somebody that can you do it? And if you can't, do you know someone that I can be referred to who may be able to assist me in that?
Really sound points, Aisha. Thank you for that.
Thank you.
Other feedback?
Well, I was just going to say, it kind of touched on exactly what Aisha and Brandon were speaking about, being that that silo. One great thing about what IRN and DMHA has put together is that we get to be these brokers of resources without restraints, right? And I did caption that right off the flyer. But it's the availability of laying out all the options and doing exactly what Justin just spoke on, is that it's not, hey, this is our treatment and we got A, B, C, and this kind of what we have to follow. It really is a holistic approach. It really is. I could call somebody up at Mercy, or I could call somebody at Pace and say, hey, I need this. Can you help with this? I would say almost on a daily basis, we reach out to, with help with the IRN doing this project, is we can reach out throughout the state. And a mentor, a man that I really look up to, used to say the R&D, right? Like the research and development piece. But, you know, it's why try to reinvent the wheel if someone else is already doing it, right? Like, why not reach out to them, ask them how they did it and how we can possibly come show us how to do it. I mean, the reason that Thrive is where it is today is because you got people like Brandon and Heather and other people that have done this process before come down and show us how to get the RCO up and going and to become part of the community, and how to get community involvement and not stay within that silo of how things used to be. So I think that's one piece, is how they have built this relationship throughout the state.
Great points, Bill. Great points. I'm going to do a round robin question, and this will be our last question for the panel. I'd like for each of the individuals to answer. Certainly, the INARMS Symposium has been a wonderful educational experience and continues to look at innovation improvements for our recovery communities in support of prevention, treatment, and recovery throughout the state of Indiana. Whether by policy, program, or model, what would you like to see implemented into the state?
Well, I'll go first. I would definitely like to see some policy, some changes around decriminalization of certain charges, so that persons that are suffering from a mental health or addiction are not incarcerated and have a felony on their record. So I could go into a lot of detail with that, but I'll just say looking at making some criminal justice reform around that.
I'll go next. I would actually want to see more around more affordable housing. Here it seems like there should be a lot more, but then there's a lot more restrictions that we are finding are coming up more and more, especially within the Black, Indigenous, people of color communities. I would really like to see more safety nets there. That way someone has a safe space to actually recover in.
Do you mind if I go next? And not to pick on the judicial part, but kind of the same realm, where the induction of MAT medication, whether incarcerated or someone that has the medication, making sure that they are accessible to all their medications, not just because they had one specific charge or the specific jail or community corrections doesn't handle things that way, and stopping the medication, but actually not only continuing medication, but also induction of medication for mental health as well.
I'll jump in. So I'm going to love Rhiannon's, but I don't want to repeat hers. Stop criminalizing diagnosis. Stop criminalizing the things people have due to their diagnosis, whether it's on them or in their house. And the other thing is let's start using people that are in their communities. Quit bringing people to communities to do things. Empower the community to do things. Have local lived experience do stuff rather than people from another community. Have someone who looks like them providing the services.
I'll go next. One thing that I think is needed is additional funding, or funding in general, to address transportation issues and transportation infrastructure in our rural communities.
I would like to see more done with crisis intervention. More specifically, those wee hours of the morning. I always think of my mom. This happened to her several times while she was still living. she would get released at 2, 3 a.m. from county and not have anywhere to go or not have a way to get to where she could be safe for the evening. So more in terms of those things, crisis intervention, not only for those coming out in the reentry process, but those who come into domestic violence situations, all types of things. Those are young people who are in foster care who transition out and don't have anywhere to go. There are a lot of gaps when it's in terms of crisis intervention and having safe spaces in those moments. So I would love to see more in terms of that.
Wow, we got a lot of work to do, you guys, because all that stuff that was mentioned is absolutely needed. And I wish there was another drum to beat, but the one that I'm going to talk about is some policy reform and criminal justice reform, specifically as it relates to statutes for syringes, for possession, for a variety of things. We consistently have been hearing for years now that we're not going to arrest our way out of this problem, but we're still arresting folks every single day for possession and stuff. That's very, just simply using drugs shouldn't make you a criminal. There's a bunch of, and anybody that's been through the justice system or has a felony simply from using drugs pays a lifetime consequence. Most people think that you do your crime, you do your time, and then it's a clean slate, and anybody involved knows that that is really, really far from the truth. And so, and that, look, that affects our people of color much more. So like Brandon over here with some felonies, I'm able, there's a good chance I might get some other opportunities, right? I'm not threatening. I fit the mold of a good recovery story that's palatable for most folks. But unfortunately, there's a lot of people that don't have my same skin tone that will never get those opportunities because any blemish on their record will prevent them from getting an opportunity. And so we got to do some work in that area. We have to do a lot of work in that area.
Thank you all for your candid comments, your excellent insights, your passion and dedication, and your statements on continued improvements for the future. We have 3 housekeeping items left. If I could have all the speakers look straight into your camera and smile. We had quite a few requests for social media posts with your lovely virtual selves here. So thank you very much, everyone. Take another 5 seconds. Speakers, please hold your smiles. Thank you so much, all. The second housekeeping item is a ton of collaboration and coordination requests within the question pane. So we will be connecting folks directly, and specifically we'll be connecting Phil Stuckey with Victoria Hanley at Regional Health Systems. She will be contacting you regarding several programs. And then for the Mercy team, Natasha and Aisha, Dee Lewis with YWCA Evansville is eager to learn about how to outreach to minority communities in the Evansville locality and how to create further recovery organizations from there. And then last but not least, we want to thank our presenters again, and I think one of our attendees, Diana Hendricks, says it best. I want to thank all presenters for sharing their stories and their efforts in working across other services and resources to offer their clients and patients the best recovery pathway possible. Thank you all, recovery community organization leaders. We appreciate your time and all that you do.
Thank you.
Audience members, thank you so much for your time and attendance. We are going to have one last session this afternoon, starting at 3:30. Our 3:30 session is the impact of law enforcement and addiction, reducing mortality with jail MAT programs, presented by Boone County Jail and Sheriff's Office. We look forward to presenting that session. And again, thanks to everyone for their patience as our technical difficulties impacted the session today. And special thanks to Heather, Aisha, and Natasha for grace under pressure. Thanks so much, all. Next webinar will begin at 3:30.